Health is wealth. The topic of nose bleeding came up yesterday, so let's talk a little on it. There would be more nose bleeding this Harmattan season because the weather is dry and less humid, so friction would be more, and there would be skin tear and blood vessels rupture. Why nosebleed is more common is because the nose has the smallest and tiniest blood vessels that are very easy to rupture and bleed out. The bleeding is not the major problem. The major problem is what is done when the bleeding starts. That practice of tilting the head backwards when the nose bleeds is a very dangerous act because what happens is that you're now forcing blood to move against gravity, against its normal flow. This will make blood flow in backwards manner, and this can cause choking, irritation, and vomiting. In some cases, it can worsen bleeding. In other cases, it can even find a route to the brain where it can go and clot there, which can interrupt blood and oxygen flow, a ground for brain issues. So please, don't tilt head backwards when there's nose bleeding. What you do is simple. 1. Get a tissue paper or clean handkerchief. 2. Keep the head in a straight form, not backwards and not downwards. 3. Use the tissue paper or clean handkerchief with your fingers, thumb and index fingers, to pinch the nose very tightly and hold. 4. Then open your mouth and breathe through your mouth while your nose is tightly closed. 5. Hold this position for a few minutes, then release and go again. Do this repeatedly for 4 to 5 times or as much as required until the bleeding stops. 6. If after 10 to 15 minutes the bleeding doesn't stop, please rush to the nearest hospital. It then might not just be the regular nosebleed, but could be something more dangerous like bleeding in the brain. So please, no tilting behind. That baby from yesterday's conversation could have started choking on her own blood, which is a dangerous thing. For more, please like, share, and subscribe to the channel.